First of all, I would like to thank the organizing committee for inviting me to be a part of this meeting. Today, my assignment is the rehabilitation law, physical therapy, and occupational therapy in Prader-Willi. I practice in tertiary care hospital named Samitivej that located about 10 miles from Suvarnabhumi Airport. And our Samitivej group of hospitals, we have 7 hospitals in Bangkok and on the way to Pattaya Beach. We had established Center of Excellence in Pediatric Rehab at this hospital for more than 10 years. Before COVID era, we had patients from around the world to come to our center, more than 200 cases per year, especially from Middle East and China. My talk today will cover the physical issue of both states of Prader-Willi and how to improve this physical impairment by means of training. Then I will discuss regarding exercise for Prader-Willi. Is it good? Is it safe? The physical impairment that we have to address in earlier years will including low muscle tone that lead to development delay and weakness of swallowing muscle. In later stage, they will develop hyperphagia that lead to obesity. When combined with muscle weakness, will lead to musculoskeletal impairment such as hip dysplasia, scoliosis, and osteoporosis. There is data to support the early intervention, especially parental education, nutritional consultation, physical therapy, including home program for their children. The important intervention for Prader-Willi will exercise program. Today I will talk and demonstrate certain techniques that we use in our center to improve quality of life of children with Prader-Willi. First, we have to understand the pathology that causes the impairment. The important issue that we have to remind ourselves that the pathology is in the brain and in the cell of the children. This causes the impairment so that we will not force our children or their parents to go beyond their ability. You can see from this slide that after the endocrine impairment, then they will develop behavioral, mental, and more physical issues. So we should address their problem according to their age and state of pathology. This slide will show that if we could not address each physical problem as early as possible, then the vicious cycle will take place, and then all the issues will be more difficult to improve because from the primary cause of hypotonia, then come the weakness, then inactivity. All this will cause more problem with growth hormone and increase hyperphagia. Then they will start to gain weight with more inactive lifestyle. All of this will cause protection from parents and increase more social issue and behavioral impairment. And so the vicious cycle keep on going. So I am very pleased to prepare the video for early intervention upon the first diagnosis of Prader-Willi for the patient who come to our center, so that the parent could start certain intervention with their children. One of the physical issues in Prader-Willi is scoliosis. It's one of the physical impairment that we have to look after in Prader-Willi child, especially in children who take growth hormone. There is no conclusive study on growth hormone and progression of curve. The stop criteria of hormone in case of curve still in progression. For the scoliosis, we use the same follow-up for idiopathic scoliosis for the planning of treatment by curve angle and later progression by curve of 20 degree, 20 and 40 degree, and more than 60 degree. In case of curve more than 40 degree, the consideration of surgery will start to ring the bell for certain doctor. We will follow up in general for every 6 months, but for Prader-Willi, I prefer to examine them and ask our team to report me if there is anything significantly changed during physical exam or treatment section. But predicting progression also still the debate issue in the treatment of scoliosis. This review comparison between conservative and surgical treatment in Prader-Willi children. They revealed that for Prader-Willi, the risk of surgery is higher than general idiopathic scoliosis, and surgery is unnecessary when high-quality conservative management exists. The principle of the effective conservative management is active, and active part. This is very important because the parent always protects and afraid of certain activity that might cause more curve. But the problem for sclerosis in special children is imbalance of the back muscle. So if they are inactive, such as sitting more than getting up, then they will develop muscle imbalance that will cause more strain in their backbone. Apart from exercise, bracing properly also assists in certain cases, but the compliance is very low. The spinal curve progression could come from the foot deformity as well. The foot deformity that we have to keep our eye on apart from flat feet is pronated feet. Certain children with Prader-Willi will have no flat feet, but they might have prominent pronated feet. They will require special insole named UCBL, which stands for the University of California at Berkeley Lab insole. The key feature is slightly higher brim, especially in middle part, not just the middle arch support. We will use the insole until they reach the age of 9 to 10. Recently, I prescribed customized shoes less than special insole in all of the cases with foot or abnormal gait pattern. In our rehabilitation center, we will prescribe both hospital program and home program to children with Prader-Willi. For hypotonia, we use Volta therapy and MAD therapy to improve their motor control.
Volta therapy. Fold the towel into the round shape. Lay the child down on the clean mattress. Place the round pillow or towel on the stimulated side. Use one hand to support his head and then slightly turn the head to the stimulated side. Put your thumb around two fingers width below the nipple line. Press firmly at least 1 minute each side and observe if there are any movement pattern changes. This therapy takes approximately 20 to 30 minutes and repeat it 3 to 4 times per day.
At the beginning of outbreak of COVID-19, we lucky enough to have a full course workshop of movement analysis educational strategy MAD therapy course in Thailand for 2 consecutive sessions, each of 2 weeks. Since then, we provide this technique to improve motor control of special children. We also teach the parents to use tapping technique to assist their children in case with hypotonia or muscle weakness to enhance their motor control for sitting, standing, and walking as early as possible to prevent inactivity. After they gain their motor ability, if they still have problem with ambulation, such as the gait, abnormal gait, we will provide leg cord suspension exercise program. We also provide this for scoliosis cases. We are one of several centers that adapted leg cord technique for exercise in special children.เครื่อง leg cord suspension หลักการจริงๆเนี่ยคือระบบประสาทของเราเนี่ยหรือการเคลื่อนไหวของเราเนี่ยจะประกอบด้วยเส้นประสาทสมองและกล้ามเนื้อการทำงานร่วมกันเป็นสิ่งสำคัญที่สุดและในเด็กกลุ่มสมองพิการหรือกลุ่มที่มีปัญหาต่างๆเนี่ยการทำงานร่วมกันจะมีปัญหานะครับนั้นเครื่องนี้ก็จึงพัฒนามาแต่เริ่มแรกเครื่องนี้ถูกพัฒนามาเพื่อฝึกโดยการใช้ฝึกการควบคุมการทำงานของสมองเส้นประสาทและกล้ามเนื้อโดยใช้หลักการในการฝึกในผู้ป่วย อัมพาตผู้ใหญ่หรือในผู้ป่วยปวดหลังนะครับเราเรียกว่า Neurac System แต่ตอนนี้ที่เราเอามานำประยุกต์ใช้นอกจากในกลุ่มเด็กที่จะสามารถร่วมมือกับเราในการฝึกประสาทกล้ามเนื้อต่างๆแล้วในการควบคุมการทรงตัวแล้วเรายังจะใช้เครื่องนี้ในการฝึกเด็กที่อาจจะสามารถใช้ระบบการฝึกเพื่อให้กล้ามเนื้อสะโพกและกล้ามเนื้อหลังแข็งแรงขึ้นเพื่อจะมีประโยชน์ต่อไปเสริมกับการที่เด็กเหล่านี้อาจจะฝึกอยู่แล้วในทาราบำบัดหรือรวมถึงการที่จะไปฝึกการใช้เครื่องฝึกเดินสำหรับกลุ่มเด็กที่จะเกิดประโยชน์นะครับประการแรกเลยจะเกิดประโยชน์สูงสุดถ้าเด็กมีความร่วมมือไม่ว่าเป็นกลุ่มสมองพิการที่มีชาวปัญญาที่ดีร่วมมือในการฝึกเนี่ยผมคิดว่าการฝึกจะได้เห็นผลค่อนข้างมาก An important thing that we provide also the instruction of parents to assist the exercise and play with their children with certain exercise technique.
Strengthening hip muscle. Lay the child down in supine position. Rest his arm on the chest and press the feet on the wall. Stimulate them to lift the hip up. Hold for 5 to 10 seconds and repeat 5 to 10 times.
Including exercise by rubber band.
Lay the child down in supine position with both knees bent. Wrap TheraBand on his thighs and then ask him to slowly open the thigh out and then slowly close them back in. Repeat this 15 to 20 times.
And PlayStation to assure the safety of play activity for their parent.
Later phase. In the later phase, once Prader-Willi syndrome children are able to walk, the aim of physical therapy is to emphasize on burning their energy through exercise program. For example, walk over the blocks, jumping forward, and climbing the stair.
Apart from physical therapy, occupational therapy also play an important part in treatment of Prader-Willi by sensory stimulation, swallowing training by oral stimulation, and cognitive communication activity.
Hello, my name is Viranpat, occupational therapist. I'm going to talk about sensory problem in the young child with Prader-Willi syndrome. All children with Prader-Willi syndrome were born with sensory deficiency. Some problems you may see like poor balance, clumsiness, difficulty concentration, exert too much or too little pressure on object, tantrum, and poor writing skill. In addition, you may see some child does not like having teeth or hairbrush, drop things easily, need extra personal space, intolerance with new clothes and tagging them, and uncomfortable to touch things. Here are some activities helping your children to develop sensory. Find the puzzles in a rice bucket. Then, let them put puzzles on the board. Wheelbarrow walking. Chicken walking. Creeping like a snake. Bear walking. sit on the swing and throwing ball into the basket. Finger paint. I'm going to show you how to massage Prader-Willi syndrome babies to encourage interactions and sensory to help them relax and sleep. It would take 5 to 10 minutes a day.
Take off his clothes and lay the child down on the clean mattress or thick and soft blanket. Use your palm to rub oil or lotion and then apply on the child's skin. Make eye contact by talking and playing with him. Massage with firm gliding and stroking around the feet, leg, arm, palm, and each finger. Massage up and down around the belly and then in circular motion. Also massage head and face. Moreover, massage his back up and down, then change into circular motion. Massage with firm pressure on both cheeks. Massage the lips by using thumb and index fingers to stretch upper lip apart. Apply the same to the lower lip. Massage the lips in circular motion by using index fingers. Use the index finger to quickly stretch an upper lip up and then do lower lip in the opposite way. Use two fingers to stroke from Adam's apple up to the chin. Jaw control up and down. Massage cheek bulge. Massage upper and lower gum. Massage the tongue in circular motion with firm pressure. Massage soft and hard palate. Massage frenulum.
We also suggest some certain toys that enhance their cognitive.
About good toys and play for Prader-Willi syndrome. Prader-Willi syndrome usually have some cognitive impairment and hypotonia, which can lead to poor fine and gross motor skill, behavioral problems, and often delay in language. There are important benefits of good toys to help developing Prader-Willi syndrome children. First one, boost IQ and offer fun learning experiences. Second, develop sense and motor skill. Third, encourage creativity. Fourth, improve concentration. And the last one, advance emotional and social development.
Exercise is main component that we will encourage Prader-Willi child and their parent as soon as possible with the understanding and under the parental involvement. This is very important. In our center, we emphasize on strengthening by rubber band exercise to improve their function, and that will prevent the vicious cycle that I have shown you in the early slide. As you see in our video, we also promote the weight-bearing program, and if they can reach their ability to use bike, and finally, water-based exercise program under our supervision is also important for them to gain function and self-confidence. This study will let us understand how we should advise the activity properly to Prader-Willi child. This review found that the activity that will lead to lower attendance are the program that too long or too vigorous. Apart from that, the attendance to exercise program are very high. This review also showed that no serious adverse event during this exercise program, except some minor adverse events such as meltdown during exercise program that too hard, anxiety leading to skin picking, and food taking improperly. Another study is information from parent perspective. That the parent will encourage their children enroll in PA program if the program emphasize on motor skill, balance, strength, stamina. I see so many parents that satisfied with our program and they will overcome their barrier of time and travel constraint to come to attend our program. This systemic review on physical exercise demonstrate that there is positive physiological effect of exercise by decreased body mass with improving physical performance. Certain studies also report some benefit in biochemical, blood testing, biomechanics, and gait pattern variable, but no promising data on body composition. All of the exercise program report no exercise-related adverse event. So the verdict are physical exercise is safe and effective for improving several variables, notably physical fitness. The review could not figure the sole effect of exercise program apart from dietary intervention. The exercise in this study are mainly strengthening training with certain study combine aerobic exercise. You can see in this review paper about the intervention of exercise. So our program finally agree that if exercise is do no harm, then advise. We try to initiate as early as possible so that we could less their inactivity that will lead to vicious cycle. Our program will emphasize on strengthening by several means, including fun and easy program. Finally, the dose of exercise will go by the field of children and their parents because we want their encouragement plus confidence to ensure the commitment to our program. So, this is the end of my presentation. If you have any question or want more information, please mail me at ravkn@yahoo.com. Thank you. See you.